Hey, this is Dr. Josh with Cali Spine, and if you have low back pain, chronic issues with your back, even with your hips, this is going to be the primary circuit that you're going to want to start with, unless told otherwise. So what you need is you need a set of bands. So you've got different colors with different strengths or different resistance. That's really all you're going to need. And what's great about this workout is you can do this literally anywhere because all you need is bands. So you can take it with you when you travel. So there's no excuse. The workout is designed to be an isometric workout, which is really the foundation is what we're laying to connect your brain to specific muscle groups and different body parts, primarily the glute. And there's different ways to activate the glute, and there's different parts of the glute. You got the glute max, glute medius, and you have the glute minimus. So we're really going to kind of hit all these different angles of the glute. So let's get started. So I'm going to choose a light band to start with. All these exercises, remember, are 60 seconds. So you must first take some time to figure out what you're trying to contract, what you're trying to do. And that's really what the 60 seconds is all about. All you have to focus on is once you get that contraction, just hold it and breathe. All right, so we're gonna be doing diaphragmatic breathing. So what that is you're gonna try to brace and basically breathe through your core area. So this is gonna look like this. Here's the first exercise. This one is the Isoclam. This is the basic resisted. So you'll see it on your sheet. You're gonna have a band on your, just above the knees, a band around your abdomen. That's just to provide some resistance for the breathing portion, right? Breathing is very, very important. As we do any exercise, we have to have some good breathing technique. So you're gonna have to kind of pick some bands that work for this situation. So you're gonna have to play with it at first, and that's okay. So first things first, when you bring your legs up, it's gonna be 90 degrees at the knees. You're gonna have it open. The whole isometric contraction is making sure that you don't move, but you have things contracted. Okay, so the knees are gonna be open just past hip width. And then I'm gonna have a slight arch in here. And what you can do if you want is you can put a little rolled up towel in here to maintain that arch, but you're gonna maintain your spine against the ground or a towel, whatever you need, depending on how your back is feeling with this position. I'm gonna have this right around the wrist, and I'm gonna have my arms up and open so I can feel that contraction, okay? So I'm just gonna keep resistance on the band, and then all I'm going to do is I'm gonna focus on a spot on the ceiling, and I'm going to take deep breaths, controlled breathing, while I stare at that dot for 60 seconds, okay? That's all it is. Now, you can kind of play around with different angles, and if you're having problems at kind of feeling it, you can kind of start with some pelvic tilts and kind of find where is pelvic neutral. Pelvic neutral for me feels really good right about there. So I can actually feel my abs kind of start to contract. So I'm right here, that feels good. So I can kind of do this to make sure that's contracted. Another thing you can do is you can actually roll up another towel and you can put that right behind your neck, because what we're trying to do is make sure there's a curve here and a curve in the neck. Those are really the most important curves to focus on. And that's if your neck's uncomfortable for sure. Put a little pad or something right here, or even a neck pillow. So again, holding for 60 seconds. Things might start to burn. If it feels too easy in certain areas, if 60 seconds doesn't feel hard, well then increase the bands, right? So just make sure the bands are strong enough for you. You're gonna have to kind of play with that part of it. All right, so that's the first exercise. You wanna basically do, you should be able to do 5 sets in a row, knock this thing out within 6 minutes. This next exercise is going to involve the glute again, but this time you're gonna be isolating one side. So this one's called the Clam, and it basically looks like a clamshell. So you're basically opening your knee up. I'll show you here in a second. What you do still want with this though is a towel that you can roll up, and you can put that underneath your low back here. The idea here is you want to keep your low back muscles quiet during the exercise. So when I set up here, there's kind of 2 things I'm looking for the setup. Number one, I want the spine to stay neutral. And if I don't have a towel or something underneath that low back area, my spine actually will sag a little bit. Again, if you feel like it's comfortable without a towel, that's okay too, but I would suggest putting a little towel in there. The other thing is you want to make sure, if this is a hard thing for you to do at first, I always recommend and start everyone leaning back against the wall or something that basically allows for you to not cheat. So I should say that it makes it so you can't cheat by cheating, what happens typically is you'll roll backwards, and during this exercise, you'll recruit maybe on the TFL area, kind of towards the front of the leg, and you won't feel it direct here. You want to feel this directly here. You have to play with this. I've had some people, even with me trying to cue them, it takes them 5 to 10 minutes sometimes to really try to find where they're trying to activate. So again, you don't want anything on the front activating. You want it all right into the glute. So you can kind of get your head to kind of rest a little bit. You're going to get your back straight, good and comfortable there. Make sure you have a band. I'm going to keep the band on my abdomen just so I can really practice my breathing throughout. Breathing, again, is essential to master, sometimes before you even get into all these exercises, so don't neglect the breathing component. So you can kind of change different angles of your hip. You kind of see like, hey, where do I feel that burn right here? Okay, so you might have to play with a little bit. Anterior pelvic tilt, posterior pelvic tilt. Try and find somewhere neutral in there. You can do a little contraction here as you're breathing, bracing and breathing through here. So all I'm trying to do is kind of breathe normal while this is kind of braced, because that kind of helps stabilize the spine a little bit. But again, I don't want my back muscles to turn on while I do this. Go slow. Biggest mistake I see people make is, number one, their angle might be off, or they just go really quick and they're not really thinking mindfully about what the hell they're trying to connect to. The whole point of you doing these rehab exercises is to reconnect to those areas of the body, specifically the glute, which isn't doing its job clearly if you have back pain, because now it's recruiting. If you have back pain, you're recruiting stabilization from your back or movements from your low back, when it should be coming from your hip, which is where the glute muscles are. Okay, so I'm going to come up here, I'm going to hold. I can also find a focus point, breathing, holding. I feel the burn right here, nowhere else. 60 seconds of just breathing. Make sure you time yourself. It should be burning. If it's not burning by the end of 60 seconds or within like 30 to 45 seconds, get a tighter band, get a stronger band. And as soon as you get off that 60 seconds, boom, 10 seconds, stops burning, boom, another one right away, okay? 6 minutes to complete 5 sets of 60 seconds each. This next one is called the quadruped or the hydrant, because it kind of looks like a dog peeing on a fire hydrant. So the idea here is still the same. We are still really isolating the glutes, just in a different way. And you can kind of see the concept here is to get your body in different positions to be able to activate and isolate the glute. Until you are able to isolate the glute, you can't expect to do higher level activities, even things like walking, without contributing to movement dysfunction, which will lead to tightness and pain, especially if you're already in pain. So here's what we're gonna do. A couple other points to make with this one. It's not just here I am and I'm going into the movement. What you need to focus on, number one, is neutral spine posture. What that really means and how to find it is, think about pushing your chin back. Think about pulling through here to go long spine. Use kind of a stick or something to go from the head to the spine to the low back. From my sacrum, which is here, to my mid back to my head, okay? So the idea here is you're going to find that spine neutral, use your pelvic tilting, okay? I'm gonna have the band on the core again, just to kind of continue with the breathing cue. The scapular movements is this. When you put your hands down in front of your shoulders like this, what people tend to do is sag down, or they don't have good stability at the shoulder. What you want to do is keep that spine neutral and push all the way with your shoulder blades until they max out right there. I'm going to hold this position nice and straight. I like to give my core a little cue just to make sure everything is in alignment. And then I'm going to bring my leg abduction, external rotation, and then extension. Again, that is the actual movement that you're looking for. However, you're gonna have to play with the exact position where you feel the most contraction in that glute. So don't be afraid to play with it a little bit. You gotta go out, okay? I need to kind of maybe play with the external rotation and internal rotation, abduction, external rotation, extension. Where is that sweet spot where I feel that glute light up? While you're looking for that glute to light up, what's gonna happen is you're gonna kind of sink down and you're gonna forget about your scapular hold. So make sure you reset. Once you find that glute hold, your attention now goes to, what am I doing here? Push back up, find that neutral alignment. Boom. Contraction. Oh, I lost the contraction. Oh, you're gonna go back and forth for 60 seconds. Just doing that is exhausting. You'll feel it in your shoulders. And again, if you feel it more here, and you feel it more, my shoulders are fatiguing out, guess what? Your shoulder blades are weak. The stabilizers that support you here are weak. Okay, so we won't even get into that right now, but just understand you might be playing with this and this for the whole time, for the entire 60 seconds, and that's okay. You'll get better at it as you do this. Remember, you want to hit 5 sets of that for 60 seconds. If it's too hard, guys, drop down a band. Sometimes you don't even need a band to start with. All right, we're back into the sideline position, but this time we're gonna hit that glute medius right here, okay? So everything stays straight. Still play with that pelvic tilt against a wall or something so you don't lean back. You're gonna keep this very slow and strict. Again, I got the towel here to keep that spine neutral. My spine is neutral all the way up to my cervical and my neck, and slowly bring your leg up until you feel a little contraction here. Now, with this one, the most common mistake, again, people move too fast and they recruit from their low back. You have to keep the low back muscles quiet. Understand that the reason you still have low back pain, and you might have gone to PT, you might have done similar exercises, is you didn't do the exercises mindfully. You didn't do them correct enough. So the correct way is to move slow. Allow your computer to download the program of activating these specific muscles. So if I slowly go up and even close my eyes, I'm bringing in more of that proprioception, more of that mind to muscle connection, and now I feel it burning right there. Okay, now the struggle's for real. Now my brain's saying, ooh, it's starting to burn, stop. Or hey, start recruiting from other areas like your spine. That's why your spine's still tight, and that's why it's asymmetrically tight, and that's why you probably have pain, because you're recruiting. So you got to strengthen these muscles that are supposed to be doing their job, right? So right there, that's all you need. You bring your foot up about shoulder width, not even, right? Hip width, and it's burning like crazy right now, right there in that specific spot. I don't want to feel it anywhere else. 60 seconds, and this is probably the most brutal one. It looks the easiest, but that burns like crazy right there. So 60 seconds, 5 sets, get to it, and have fun. You can thank me later when you're out of back pain. All right, so we're doing the modified bird dog, which is essentially an assessment for you. And if this is difficult to do, then this tells you that your primary deficiency or weakness is generally the hips. And by that we mean glutes, glute stability, which is really the foundation for your spine. So again, if the spine is getting tight or you're having chronic pain in your spine, then we have to look at, be like, hey, what's going on with the pelvis? And why is that maybe not staying level? So every time we take a step, if I step and I put weight on this leg, this glute, different muscles of the glute need to contract, especially glute medius. And when I step right here, there should be no drop, right? So a common assessment we do, and there's subtle variances of this, but in general, there should be just rock solid right here as this leg comes through. Now what we see is these functional little deficits of the glute contraction, and then over time, months to years, that you start getting this compensation in your spine, especially the quadratus lumborum muscle, which is, again, stabilizing that low back. So as I step here, if this drops down, this glute's not doing its job, you're going to start noticing certain things like the quadratus lumborum fire. Think about it like this. I have to kind of bend my spine to get my weight over the foot, okay? So again, there's a lot of different things going on here, but this is kind of the thought process behind it. Glute's not working, you can kind of think how it's going to travel up to your back. Your back's going to do some kind of compensation to kind of get through the movement, whether it's walking, squatting, whatever it is you're trying to do. So here's what we want to do. We want to get into the classic bird dog position. And what I'm going to do is I'm actually going to make this harder, because I should be able to do it with a narrow, pretend you're on a balance beam. So I should have a narrow stance here. Opposite hand and knee. I'm going to basically come nice, tall, neutral spine again. Might want to use something like a stick again, just to kind of make sure. Is going to be, as you can see, I'm not going to drop the pelvis. There's no dropping. Again, if I drop the pelvis as I do this, or if I have a hard time getting this stable right here, well, if that stick falls off, what does that mean? That means that hip isn't doing its job, as well as the shoulder. This is very common, but most of this obviously is coming from hip, right? If the hip's not able to stabilize, guess what? It's going to translate the same way here like we just talked about. It's not stabilizing as you walk, as you run, as you squat, or whatever exercises you're doing. So you can use this as an exercise as well. I like to use it as more of a benchmark, a checkpoint after phase 1 glute isometrics. Again, we're trying to prime the area, priming the glutes, getting that connected isometrically to the brain, really ramps up the connection to the brain. Then we go in, right, when we're not completely exhausted and fatigued, then we can kind of start reassessing this on a daily, on a every other day. And then you can kind of see as you get your glute turned on, boom, you'll be able to stabilize that, okay? Now, common issues with this one is, again, the shoulder with fatigue out. Guess what? Your glute and your shoulder then, they're both weak. So you clearly have a shoulder stability issue as well then, right? It's kind of weak. Specifically, when I'm here, the serratus anterior, and that's going to be the muscle right through here. It brings the scapula, the shoulder blade, it kind of brings it right into the rib cage right there. So it pulls it forward like this, okay? Scapula's here, kind of pulls it out and into the rib right through here. You can see those muscles. That's what stabilizes this movement right here, mostly serratus anterior. So you might have some problems with serratus anterior. Maybe you had a shoulder injury. I don't know what it is for you specifically, but just know that you need to also train the shoulder stability, specifically serratus anterior, with that, and kind of compare it back and forth and see, is it easier here or here? Because usually you have one side that's weaker and one side that's stronger. Another contribution to maybe it's not so much that your shoulder's just so weak or unstable. Maybe it's also the way you're positioned. So make sure you're 90 degrees and 90 degrees. So it should look basically like a 90-degree angle here. If you have too much weight in the shoulder, you might have your knee back not at 90 degrees. It might be more like at 45, and now I've got a lot of weight in the front of the shoulder if I'm keeping this in line. Check your knee, look in the mirror, take a video of yourself. Is your knee directly below your hip? Because if it's not, you're gonna have more weight into the supporting shoulder. Final point, again, when we did this, we took a very narrow stance. You can see how this kind of lines up, pretending you're on a balance beam. And if this is all over the place, as a good rule of thumb of an exercise, you can always go a little bit wider to start. Do it within your ability. So if I kind of inch out, let me see if I can stabilize right there without falling all over. Okay, boom, there you go. Now you have a good benchmark to say, hey, that's where I got it. I can hold that for 1 minute. Can you hold it for a minute? If not, you might have to start out here, okay? At the end of the day, these are just some simple assessments to kind of tell you how well those different regions are doing. It also helps you kind of isolate to know, where's your main problem? Is it in the glutes? Is it more in the spine? Where's kind of the primary issue? And as you know, if you focus on those areas, you'll get stronger.